want to talk about painful menstruation or dysmenorrhea, but with a slight context. And the context for today is for us to point to what is normal and what is abnormal. So what is dysmenorrhea?
Dysmenorrhea is like a medical term for painful period. When the uterus is contracting for blood to flow out, this pain comes with heavy flow.
How will these women know if they do not actually track period? Because people have linked tracking of period to
pregnancy.
Yeah, pregnancy and safe sex.
Yes.
What of cotton wool?
Oh my goodness, that is so unsafe. People still use cotton wool. I have a question.
Okay.
If you use
I
wool,
ask because I know what you're about to ask, how they use it.
Yes.
So she explains that they bring it together, squeeze it very. So I don't know how much they have to
squeeze
so,
to
but
hold.
they bring it together and then they insert it into the introitus.
I'm begging you that you should not use cotton wool. Those
Feeling
fragments, if they get up to the vagina, they will cause serious issues.
Is there something that can be done about it? For the years I've practiced as a medical professional, oftentimes I get to interact with people, and sometimes they come to consult me or maybe ask questions. And one of the most frequently occurring questions I get, especially from females, is the issue with painful menstruation. So they usually come and ask about pains during menstruation. And we know that it is normal, due to the effect of prostaglandins, as we discussed on previous episodes of this podcast, but sometimes it can be abnormal. And today we're here to have this conversation, to point to you the normal from the abnormal. Welcome to another episode of the Intimate Matters podcast. And on this podcast, we take you on a deep dive into the world of sexual and reproductive health. We talk about everything sexual and reproductive health. We look at the physical aspect of it. We look at the spiritual aspect of it, the psychological aspect of it, even the societal and cultural aspect of it. And we even delve deep into the legal aspect of it. And for today, we're going to talk about something that is really, really concerning and has really, really been a problem to many women. We want to talk about painful menstruation or dysmenorrhea, but with a slight context. And the context for today is for us to point to what is normal and what is abnormal and how you can know this. And in the studio with me today is an amazing professional, a registered nurse. Thank you for joining us today, Nurse Aniedu.
Thank you for having me, sir.
Thank you so much for coming. So I'm just going to start with like the very basic of this conversation. Okay. Let's start with, before we point at the normal and abnormal, let's talk dysmenorrhea. Okay. So what is dysmenorrhea?
So dysmenorrhea is like a medical term for painful period.
Okay.
Just painful period. The medical name for it is dysmenorrhea. It's just like when the uterus is contracting for blood to flow out. That is where this pain comes from. It's just the pains that come from contraction of the uterus so that blood will be able to flow out. So that's what we call dysmenorrhea. Okay,
so when we talk about dysmenorrhea, is it something that happens to every woman? Because I don't know, will there be somebody sitting and watching this and be like, I cannot relate to this conversation?
Yes,
or is it something that happens to everyone?
Definitely. There are a lot of persons, females that don't have it. Okay. While there are some that, in fact, they already know that it's going to come in like 1 week.
Okay.
It's because the contraction starts even before the period comes. While there are some that have it maybe on the first day, some have it throughout. It differs from persons to persons. I feel it's because of the genetic makeup and level of hormones that one has. That is where the differences come in.
Okay. Yeah. So is it like you talk about genetic makeup? Is it that as a lady, I'm supposed to expect that if the females that have in my family that have come before me, I'm talking about like my mom, my aunties, my grandma, and the rest, that if they experience it, there is a likelihood that I'm going to experience it.
Yes, there's a likelihood that you would experience it.
Okay. So while we're looking at it, just before we get into the crux of the whole issue, is there something that can be done about it? Like dysmenorrhea itself, is there something that can be done about it?
So the primary dysmenorrhea eases with age, with lifestyle modification, with childbirth, and also drugs, medications work. But when we get into the abnormal, that's the secondary dysmenorrhea, some of these things do not work for them. That is because they are linked to underlying medical conditions.
Okay.
Yeah.
So what are the primary dysmenorrhea linked to? Because you talked about the secondary being linked to underlying.
The primary is just see it as the uterus squeezing for
Okay.
blood to come out.
Without anything.
Nothing is linked to
Okay.
it. Yes, that's just it.
All
The
right.
uterus squeezes, blood comes out, and that is when you feel the slight cramps, low
Okay. So
abdominal cramps.
I'm curious because this is something that many people have been asking. You talked
Okay.
about how it can be relieved with age, with childbirth.
Okay.
Is this like a generalized thing, especially that childbirth? Because many people have had the okay. Before we come to childbirth, I've had conversations about that dysmenorrhea is a thing for what the virgins, like people who've never had sexual relationship. So I see most guys sometimes will tell a lady you cramp or you're having dysmenorrhea, right? Come, let's have sex. That
Sex,
so
yeah.
is it that I didn't hear you mention that, but I just want to point that out. Can it help with the
Okay, I've been hearing that too, but then I made researches and I've not seen anything that is linked to sex and even childbirth. The childbirth own, I feel is psychological,
okay?
because the contractions get is more when you are trying to give birth. So you are now used to
So your pain threshold has
as
been
increased
okay.
as skyrocketed. So it's not like there is no pain again. There is still pain. It's just that your threshold is now higher
Okay, so
than
you be
normal.
like, get waiting happen when never happened before. I
Yes,
don't see waiting
yes.
past
I
this one.
don't see that.
So ladies in the house, I think you've heard from us and here do if you're having cramps and somebody says that it's because you've not yet had sex, that you should come and have sex. So
It's
that
a
the cramps
lie.
it's a lie.
Run
It's a
away.
lie. Don't take it. It's one of those it's one of those lies that boys tell. And I know my gender will not like this, but I have to do what I have to do. Okay, so as we're moving on, another issue I want us to look at is the issue of medication.
Okay.
People have this anxiety, if I should say, or worry when it comes to medication. Talking about the issue of how much is too much. Can I be taking it all the time? What's the risk of addiction and so many other stuff?
Okay, let's start with NSAIDs, non-steroidal anti-inflammatory. Those are the ones that I would recommend. Okay, you take it, because when you take steroids over time, it causes a lot of issues like pelvic inflammatory diseases. Because steroids are linked to inflammations. So the NSAIDs, the non-steroidal, the normal, over-the-counter pain relief can help. But over time, it causes an ovulation. You will not be seeing your ovulation again.
Okay.
And when you don't see your ovulation over time, your cycle will change. It will interrupt your cycle. So that is why I do not advise taking this medication over and over again, like all the time. And then there's some of them that are actually addictive.
Okay.
So those ones we don't even go there, we call them dangerous drugs.
Okay.
It is when the pain is so high, like the person cannot bear it again, and that's when we give, and we don't give it often. So we don't even encourage that. Yes. So there's risk of addiction, there's risk of anovulation, and yeah.
Okay.
that's
So you said so high. How much is too much?
Okay.
So that as I'm staying, as our viewers are at home watching this, they could know how to grade their pain, know when it
Yeah.
is like too high.
I feel like it depends on the individual.
Okay.
My own too high might be somebody else's. I know they even feel am.
Okay.
It just depends on the person's level of pain threshold. Yeah. So, but when we see that, there are some, especially if the person has ulcer, there are some that can kill. You would see that this person is dying. So
Okay.
at that point, we just have to give that dangerous drug so that it will just calm
Okay.
the
So
effects
it
down.
means that dysmenorrhea can exacerbate
Yes, it can.
ulcer pain.
Yes, it does. Because when you are having this menstruation, when females have it, some of them rarely eat, especially when it comes with the pain, excessive pain. You don't eat, and then that increases the way the ulcer, it exacerbates the ulcer pains and everything, the
Oh.
symptoms.
Okay, so please, if you have ulcer out there, I hope you hear this, and you know that I know that some of the symptoms comes with constipation, bloating, which may not give you this feeling of wanting to have
eat,
something to eat,
yes.
but look at the other issues that you have and try to eat. Okay, so this is like for the primary. So looking at the secondary,
Okay.
you talked about secondary dysmenorrhea, talking about some underlying factors. what are like the possible underlying factors?
For the secondary.
Yeah, for the secondary.
Okay, this the very common one is fibroid.
Okay.
Another one we have PCOS. Most women know about this polycystic ovarian syndrome,
Okay.
endometriosis, PIDs, pelvic inflammatory diseases.
Okay.
So those are the conditions that are linked to this secondary dysmenorrhea.
Okay. So you, as we're looking at this condition, so how then can I distinguish between that this is a primary that comes with the fact that I'm female and my body requires that the womb needs to be contract for
Okay.
expulsion of the endometrial lining, and the one that I know that there is like an underlying problem.
The differences is always the pain will be extreme. If it is primary dysmenorrhea, I feel like everybody should be able to handle it at some point. Although it is painful, but you can handle it. But when it comes to secondary, you can't even handle it.
Okay.
And then you would feel pain before the period comes. It gets worse during the period, and then the pain still persists after the period.
Okay.
Let's say about 2-3 days, you finish seeing period, but you're still feeling cramps. That is not, you would know that I should run and go and see a doctor. Another thing is bleeding. When the bleeding is heavier than normal, the flow is too much. You know your normal cell flow. You will know that, okay, I change maybe 2 to 3 times. But when it gets heavier, you have to change 4 or 5 times in a day. That is not normal.
Okay.
Another thing is you're going to feel fuller. Let's say if it is fibroid, as it's growing, you feel fuller. The bloating is more. The fatigue, tiredness, the back ache is more than normal. You will know that, okay, this is not normal.
Okay.
And then even if you take pain medications, it doesn't work. Yeah, so those are the signs that you should look out for when you are trying to distinguish between primary and secondary dysmenorrhea.
Okay. So you've talked about, I think, emphasis on the fact that there is pains before, pains during, and
Pain after.
the period. So
Heavy bleeding.
Heavy bleeding. So when you're looking out for yourself there, you should know that if you're seeing these pointers that are pointing to possible issues. So if you're just joining us, we were discussing the fact that we know dysmenorrhea happen, which is pains during menstruation. But we also know that it's not every pain that is normal as it should be. So we're discussing how to be able to spot the normal from the abnormal. So do well to like and follow us on all our social media platforms. We're on YouTube, on TikTok, on Facebook, and Instagram. And when you go to our YouTube description, you see a link to our WhatsApp group where you can join and get to interact with us. And if you've not yet subscribed, you should subscribe. And also share this video and drop a comment if you have any question. So Nurse Aniedu talked about fibroid and the heaviness. So let's just point out to other things that you've mentioned. You talked about PCOS. So how fibroid may be the feeling of fullness and the pains. You talked about the pains around the waist. So is there like any distinctive thing when it comes to like
PCOS?
Yeah, a bleeding, a painful menstruation that is linked to PCOS.
Okay, PCOS, it doesn't really come with pains. If you're having other signs of PCOS and then you feel pain too during your period, that could be a pointer that your ovarian cyst is either enlarged or is ruptured.
Okay.
Yes. So PCOS is more like a traffic jam of hormones. The hormones are more than normal. You are seeing other signs and symptoms. But the moment you start feeling pain, you know that the ovarian cyst, it's either enlarged or it is ruptured.
Okay.
Yeah, so that is what causes pain during PCOS.
Okay. So I want us to talk about something which, as always, I think many women have come across again and again as a problem. Endometriosis.
Okay. So that is like tissue like endometrium going outside the womb. That's like tissues going outside.
Okay, like the tissue of the uterus going
outside the uterus.
What did they go outside to play?
I don't know.
Okay.
But it is non-cancerous. It's a non-cancerous kind of growth. So the reason why pain comes here is because the endometrium is now fuller. the uterus is now carrying another brother and sister, so it's making it heavier for you. So whenever, as a lady, you are menstruating, the contraction will now be too much because this thing is heavy. So the contraction will now be stronger. It will now feel very painful, and then the bleeding too would aggravate
Okay.
because of the weight that this uterus is carrying.
Okay. So and also because of the fact, like you've talked about, these tissues being outside the uterus, are there like specific places that?
No, they are just very close to the uterus. Just that they are not together. They are close to the uterus.
Okay.
Yes, but they are not like inside. They're just outside. So whatever contraction that the uterus is feeling, this other one is there together. It's pushing itself. Just
Okay.
yeah.
Okay. So because it's still made up of the same substances, if I could say, like the uterine tissue,
Yes. Yes.
every action that happens to the uterine tissue that are inside the uterus also happen, and because it sheds, it also bleeds more than it should actually bleed. So it's
Yeah.
essential that we know about this. But before we go into how you can help yourself, possible things that you should look out for how it is like this. You talked about bleeding, bleeding heavily. Now, is it possible that I can feel that I'm bleeding abnormally heavily, and it's like, but it's not abnormal?
No.
Okay.
You will just see that you are bleeding abnormally.
Okay.
And these things, something I forgot to say, it happens when you're from your 20s down to your 30s. That is when you have risk of all of these fertility issues. So that is another thing I forgot to point out.
Okay.
So while you were at your teenage, so you know that, okay, I used to change my pad even one or twice, 3 times if I want. As you are growing older, you notice that it is more. Some people change 6 times. That is wild. So you will know that, okay, this is not normal. But when you are feeling that it is, but then you're not seeing the signs, it's just psychological.
Okay.
Yeah, you will see it that you are bleeding more than normal.
Okay. So what do you say to women that, because I meet women who say something like, since I was born, every single time I have a period, people for the environment know they hear what, like in terms of pain, maybe I'm crying, maybe, so, or they'll say things like, since I was born, every time I have period, the whole house go they scatter and the rest of the thing. So because you talked about the fact that most of these abnormal ones are like secondary, but this is since I was born. So is it possible? Is there a possibility that it can also happen since somebody was born?
Yes. Primary dysmenorrhea happens 1 to 3 years after menarche. You will start feeling those pains. But if it aggravates, that's what I'm saying. Primary can change to secondary. If as you're growing, you know that this is not how I used to feel this pain, it is getting worse. That is when you need to take yourself and get checked.
Okay.
Like me, I've been having pain since I started menstruating. It's just the same. It's been the same since. So there's no cause for alarm. At some point, I even thought it was issue. So I used to go to the hospital, run scans, see things. It still came out the same, nothing. So I just knew, okay. But then if I take pain medication, it works. And those people that used to shout, some of them is a low pain threshold.
Okay.
Some of them, it's not actually secondary dysmenorrhea, it's just low pain threshold. But if you feel that your pain threshold is high, you can bear other things, but you cannot bear menstrual cramps, please go and get yourself checked. There are series of tests that should be done, series of scans you can do to confirm that you are okay and that it is just normal pain.
Okay.
So yeah.
All right. So thank you for pointing that out, because I'll ask you, can you give us like examples of like this series of tests that can be done?
Okay, scans, abdominopelvic scans. If there is fibroid, it will show there is fibroid. If there is an inflammation, that's PID, it will show that there is an inflammation. And also, that is basically abdominal scan. That's what we do. And then, which other one? Yeah, basically abdominal scans. And then there's some questions that a gynecologist will ask you that he will know, okay, this is not normal.
Okay,
It's
this
normal.
is
Yes.
the abnormal
Yes.
away
Yes.
from the normal. All right. So as I know it's good to go to a hospital and get yourself checked out, but in terms of trying to help yourself,
Okay.
in terms of you trying to manage yourself as it is, what is it that someone can do, like that the lady can do?
Okay. Cut down on sugars. First things first.
So make I know they chop, make they know they carry me go out again.
Cut down on sugars, cut down on processed carbs, and also exercise is very good. I can say for sure, I have felt the impact of exercise. It is very good. And also, I recommend hot water bath, hot seat when you're on your period. Use hot water bottle and massage your back, your abdomen. If all of this hot tea. There's some native soups I prepare. Uh, I use all of these native spices, and it also helps. It also
Native
helps.
spices like
Like Eden fruits. Eden fruits. I think that's how they call it in English.
what's the Bibion name?
Oyayak.
Okay, Uyayak, all right.
Yes, Eden fruits, ata, all those small fruits. When you take them, it eases the contractions. Yes, it eases them for me. Green teas too work for the Oyibo people that don't like native soup. You go for green teas. You go for walks. Just walk around. I'm not saying you should go and run around the street though. Just walk, take like 15 to 10 minutes walk around. Then in all of this, you feel it's not working, you can go for pain relief medications.
Okay.
Pain relief
While you're
medications.
waiting to go to get yourself assessed and
Check.
checked out.
Yeah.
All right. So have you seen somebody like gone through this process? Have you known somebody that has been like maybe experienced this, and how it ended for them in terms of somebody who possibly has had maybe for example primary dysmenorrhea, like somebody who had primary
It's
dysmenorrhea.
myself now.
Okay,
I
because
just
I
use
feel
myself.
my mom used to say that she used to have menstrual pains,
Okay.
and
As she
although
gave birth.
now, yeah, she's given birth. She's given birth more times than some people would even like it. But as it is now, although she's perimenopause, so she doesn't menstruate that frequently. But as it is now, also know that at the later part of her life, as I've come to see, that once in a while the pains may come,
Okay.
not the kind of crippling kind of pain that could keep her at home and the rest of the things. And
Okay.
I think I also have siblings, younger siblings, who also have pains, and I think that is like a hope for them.
It's hope,
Yeah.
yes.
So they use that as a point of, how do you call it, as a point of contact, and be like,
Point of solace.
yeah, if
God,
it
at
used to
least.
happen, and now mom is okay, that basically it cannot happen. So what we're trying to say is that yes, it can happen. You can have pains during menstruation, quite essentially, but then you should be able to point between what is normal from the abnormal. And one of the pointers to the pain is actually how much is the pain. Now, respecting the fact that this pain is individualized, it differs from persons to persons,
Yes.
but it's essential for you to know that if it stops you from performing your
Yes.
activities
Yes.
of daily living,
It is not normal.
it is not normal.
Yes.
So I should be able to, even when I'm having a pain, I should be able to go to school,
Yes.
be able to go to work.
Yes.
Okay, so please put it out there so that if it stops the activities of daily living, and also look out for the fact that you felt pains before, you're feeling pains during, and also you're feeling pains
After.
after the period.
And then this pains comes with heavy flow.
Okay.
Yes. If this pains come with heavy flow, just run and go to just get yourself checked. It's all normal.
Okay, if
Yes.
it comes with heavy flow. So they talked about the fact that you have to, within the 24 hours, you have to change your sanitary material, because there's so many sanitary materials, most likely parts. You have to change it like 3 to 4 times.
Three times might be normal. if you are
Okay, so
trying to,
from like
yes.
4 upwards.
Four upwards, yeah. Some people have changed. I've seen somebody that changed it 6 times.
Okay.
So at the end of the day, after she went to the hospital, she actually saw that she had fibroid.
Okay.
Yeah, so she has gone for surgery now. She's better. The flow has gone back. She changes her pad twice. The pains have reduced.
Okay.
Yes. So that is how I know. I've seen other people, so I know that this irregular flow, a be heavy flow, and then the sometimes it's also irregular.
Okay.
The menstruation, it will come this month on the 10th. You are expecting it's supposed to come after 28 or 26 days, and it will come like 2021.
So how will these women know if they do not actually track period? Because it's something that we've been
Please,
saying
you
on this
have to
podcast.
track your period.
Okay.
You have to track your because how will you not if you don't track, you will not know. So you have to track your period. I've been tracking my period since I started feeling this pain, because when you go to the hospital, that is actually what question
One of the things that they're
they
going
will
to ask you.
They will say you should provide a 6 month cycle
Information.
tracking.
Okay.
So if you did not keep it, how will you know? The first time I went, I was so embarrassed. That was when I started. I started
So,
keeping.
Mafion, as you're listening to us, it's quite essential that, because most time when you ask people to track their period, unfortunately, people have linked tracking of period
To pregnancy.
Yeah, pregnancy and safe sex.
Yes,
So
that's all.
if now you're telling someone track your period, be like, I'm
know,
not doing
I
anything
know,
now.
I'm not.
I'm not doing anything. So it's not just yes, we know that most of you that track the period, you do something, but who are we to say what we have to say? But what we're here to say to you is that, like I tell people, your menstrual flow, having the right information about your menstruation should be it's a core aspect of your health information.
Yes, very, very.
Sometimes it is this, I call it the secondary vital sign for a woman, because most likely if there are issues with yourself, most likely it's gonna affect your period. Either it's gonna affect the flow, it's gonna affect the
Yes.
cycle, and as the case may be. And you talked about this thing. Please, just how do we do in terms of, we talked about knowing your flow. Now, I saw a post on social media where a man was talking about menstrual product, because this thing you're saying, it's easy to know with pads,
Yes.
or maybe you're using tampons or you're using cups. What of these people that now use Pampers?
Is it that heavy that they're using
I
Pampers?
do, I went online and people say they use Pampers as a menstrual product.
I think I saw that, but I commented on that. I asked if it's because the flow is heavy. I've not gotten a response till now.
So because I'm trying to wonder how we can, because if it's pad, you can you know the flow, and okay, let's leave Pampers, because now I'm saying Pampers. Some people will widen their eyes and ask Pampers. What of cotton wool?
Oh my goodness, that is so unsafe. People still use cotton wool.
I know somebody that.
Oh my goodness.
See, the funny thing is that this person that uses cotton wool is learned. Let's use that one, because if it was a child, if it was an illiterate, a teenager, I would understand. Should I? This, I think she's a master's degree holder.
And she uses cotton wool.
She also she's not a health professional, but she's like a sub-health professional, because she's working as a staff for a health outfit. So slowly she's like a pseudo, she's rubbing off bit, but then she uses cotton wool. And the funny thing is that the way she told me was that
she's so confident.
She's so confident and made it very known that she's not the only one.
So they get like association.
No, it's not like association, because when she said it was like, me and my girls ate one. You get, like, me and my ladies. So is there a way that it can be measured for them?
No, you cannot.
All right.
Please, how do they? I have a question.
Okay.
If you use
I asked because I know what you're about to ask. How they use it?
Yes.
So she explains that the cotton wool is quite loose.
Yes.
Right. So they bring it together. Squeeze it very. So I don't know how much they have to.
Squeeze to
but
hold.
They bring it together. They squeeze it tight, and then they insert it into the introitus. Because what happened, how I got this conversation was, I think we went for a program with the said lady, which I'm very sure she's going to watch this. So when you watch this, know that this is you and do the right thing. Because they said it's quite unsafe. And I was near to say it's quite unsafe. So she was like, I feel my period is coming. That's what she told me. I was like, don't you track your period? That was the first thing. She was like, no, like, but if you track your period, you would have gone out with a sanitary product, maybe a pad, and you could excuse yourself, get into any wash facility and do what you have to do. And she was like, not even that bad. Maybe I'll just branch a pharmacy and buy cotton wool. I was like, I was like, cotton wool? She was like, nah. Now, I think she just turned 40. She's like in her early 40s. And she was like, do you know how long I've been menstruating? I was like,
Please, I don't know how it works for you, but I'm begging you that you should not use cotton wool. The reason why is because cotton wool is not originally designed to absorb that amount of blood.
okay.
So the moment it gets soaked, it will start giving off tiny particles.
Okay, those fragments will start.
And those
peeling
fragments, if they get up to the vagina and find their way in and stay there, they will cause serious issues. Because it is not like blood clots that can come out with blood flow. It will stay there. There might be a growth that would start growing. It might be, pain that would just, unnecessary pain and even excessive bleeding. So that is why we say they should not use these things. Cotton wool, tissues. They don't have that, I don't know how they do it, but they don't have that covering, what is supposed to absorb. They don't have that absorbent property in them. So that is why it is not advised.
I think I want to come to that, but you've already rushed to mention, because another set of people
Use tissue.
is the tissue people.
Please. Tissue is even the worst. The way she says she squeezes the cotton wool, maybe, I don't know.
No, I think tissue on, I know, so tissue people, they don't squeeze it.
They just wrap it.
Yeah, they just
Wrap it
and make it like, they could use something like this and wrap it. It might not be this big, but they'll wrap it in. And just like the place part in the panties, they'll wrap it and
place it
there.
And they don't get stained.
They finish one roll of tissue now.
Oh, okay.
They will make it.
Is it like it's cost effective? Because it's not. To me now, reasoning it is
so
not.
I think the first time I heard about it was the issue of availability.
Pad is everywhere.
Some people don't feel that it's everywhere, but then it's also because why I wanted us to talk about this, because I know that this fragment, like you talked about, staying in can result in certain infections.
Yes, infections
That will result in
complications.
That one of the signs may be very severe pains during menstruation.
Yes.
So if you know that you're out there and you use any of these things, we're talking about tissue papers, I'm talking about cotton wool, know that you're putting yourself at risk of a secondary form of dysmenorrhea. Because if these fragments stay in your body system, which most of them does.
Yes.
Fortunately, unfortunately, you might have a strong immune system, lymphocytes that comes, picks it up, and
you might not be lucky every time.
Yeah, and cleans it up. It's possible that as you go on, it may become a problem. And when it becomes a problem, it can result into secondary dysmenorrhea. So it's something that you also need to know.
Yes,
and
please.
You also talked about the fact of knowing that there are certain disease conditions. So I want to ask, are there actually drugs that can lead to this, cause this kind of problems?
Drugs that can cause these fibroid?
No, not fibroid, like the pains. Because I have somebody that, feel pains and always like, have some months she feel pains and some months she doesn't feel pain. And she's always like, any month she feels pain, she want to like have a run through of
what she ate,
what she did that would have caused. So possibly are there like drugs that may, put somebody at risk of having this much pains?
Everybody has a way their body reacts to certain drugs.
Okay.
So what reacts, what makes me have painful menstruation might not make another person have it. You get so.
Okay.
So yes, drugs can do the most sometimes, because there are a lot of components, a lot of things that make up drugs.
Okay.
So maybe one or two or more of those components could have a reaction with somebody's genetic makeup, and then that would lead to pain.
Okay.
Yes.
All right. So it's
But then
essential.
I cannot say the type of drug because each person different, different person, different reactions.
Okay. So it's essential that you also know what, in fact, it's advisable. It should be the right thing to do is for you to always put any drug you're about to take, pass it through your medical
Yes,
professional,
it should be prescribed.
to get the right information about it, because these can lead to various side effects that you may not have been bargaining for. So for today, we were talking about painful menstruation, what is normal and what is abnormal, and we've been able to point out to you that yes, it's normal to feel menstrual pains or pain during
Yes, it
menstruation.
is.
That's what we call the primary dysmenorrhea, which will get relieved as you grow older in terms of age, and
Yes, lifestyle
also
modifications.
lifestyle modifications
I
like
mentioned
exercising.
exercises, eating more proteins, cutting down on carbs and sugars, drinking more of hot tea and native spices.
All right. So when we talk about proteins, because most time they talk about proteins, everybody looks for
Egg.
the big proteins, the chicken, the big.
Please,
We have small,
the
small.
master of the all the protein is actually egg safe.
Okay, so we have small, small proteins. The ones that you can pick around you,
Egg.
like you can use snail. People will say snail is expensive, but if you enter your backyard and find snail,
You
it's not
see it.
not expensive.
Okay, if you say snail is expensive, egg go.
What
Egg
of
is how
these
much?
other smaller snails? I don't know how they call it, but in my language they call it nkoriko. You can use that one. Those ones, if you have a good place that has a
You'll
fence,
see it though.
as it's a rainy season, if
Yeah.
you'll be watching this during the rainy season, you can go out and pick it. So it's important to know about primary dysmenorrhea and secondary dysmenorrhea, which is the abnormal part of it, where you have underlying issues. We looked at how PCOS can play in, fibroid can play in, endometriosis can play in, and also how certain lifestyle we do in terms of consuming junk and processed food can really do. And also we talked about drugs. And we tell you that one of the core things to look out for to differentiate between the normal and the abnormal is the fact that the pain stops you from doing your activity of daily living, and also you feel pain before, during, and after your period. And most times it comes with excessive bleeding.
Yes.
So hence the need for you to track your period, because you can only know excessive bleeding when you track your period and you're able now to differentiate what is normal from what is abnormal. And I think we move on there to talk about some certain menstrual product that you should not be using. People are still using, like cotton wool and tissue. You should not use it because those fragments may get mistaken to your body, leading to problems like PID that may still result in painful dysmenorrhea. Thank you so much for joining us, Nurse Aniedu.
Thank you.
Really
Good nurse.
appreciate you. Thank you so much.
Thank
Do you
you.
have any last words for the people that will be viewing this?
Okay, so let me just do a brief rundown. So see primary dysmenorrhea as the uterus contracting to squeeze blood out. Then see secondary as something causing it to contract more. And then the blood to coming out more. Okay, let's say for instance fibroid. See it as if there are stones inside the endometrium. So when it is trying to contract, the stones rub against each other. That is where the pain comes. See endometriosis as the uterus bigger than, let's say you are using your hand to squeeze orange. Now this orange is now bigger. So you have to put extra force and extra weight. So that is where the pains and more bleeding come. See PCOS, polycystic ovarian syndrome, as a traffic jam of, think about Lagos traffic. Then think about it as traffic jam of hormones. And then if you feel pain, you will know that either the ovarian cyst is enlarged or is about to be ruptured, which means you have to take immediate action. So please try to modify your lifestyle, eat properly, do exercises, schedule exercises. It doesn't take time. 15 to 20 minutes, squats. Yeah, do take a little walk around. Do more of warm water compress. Drink more of hot tea, hot water. I'm not saying sugar, I'm not saying Milo and milk. Green tea, could be Lipton. That you know, don't really rush to take medications. Do all of these things first, and then if it doesn't, if the pain is still like there, you can now go for medication. But make sure that this medication is prescribed by a doctor, a medical doctor. I know that everybody is doctor now, so please ChatGPT and Google is there, so everybody don't tell doctor. So please make sure it is prescribed by a medical doctor. So yes, you would be able to with these things, and then also look out for age, from 20s to 30s. If these symptoms comes, the pains, the bleeding, then you should actually get yourself checked. Even without these symptoms, generally, please just one day sit down. You have extra money, just go and do scans, get yourself checked, because you might be saving yourself from a lot in future. So thank you.
Thank you so much. So, like they said, if you have any issue that stops, if you have any pains during menstruation that stops you from performing your activity of daily living, do well to go get yourself checked out. It's quite essential. In fact, don't even wait for something to happen. Do a routine checkup is what we advise. So that is what we have for you on this episode of the Intimate Matters podcast, your go-to podcast as it pertains to issues of sex and reproduction, as it pertains to issues of your sexual health. We believe your reproductive health matters. That is why we have this podcast. And do well to follow us on all our social media platforms on YouTube, TikTok, Instagram, and Facebook. And do well to like this video, comment on this video if you have any question, and also share this video so that others may also learn as you're learning. And check for the link in the description to our WhatsApp group where you can join and also interact with us. And we'll be glad to hear from you. If you have any suggestions, if there are topics you want us to talk about, please do well to let us know. Thank you so much, Nosanyedu, once again. Thank you so much to you out there that has joined us today, and we're glad to have this conversation with you. And we know that we'll be bringing you more conversation as we proceed, and until we come your way next time. Thank you so much for listening to us. My name is Nosakwa Wokban, and I am your host on the Intimate Matters podcast, and this is bye for now.